to get things done, do we need to pretend we're in a pandemic? Right? Because we very quickly go back to too many checks and balances sometimes, which is important, but there's got to be a happy balance.
I'm Dr. Louise Messara, and this is the Future Health Podcast. We're all witnessing a virtual health revolution, and today we're diving into the explosion of virtual care solutions, with a special focus on medical-grade pods. Imagine a safe, private space where you can have a virtual consultation with a healthcare professional, no matter where you are. Well, state-of-the-art pods may be making an appearance shortly in a hospital, library, or even shopping centre near you. Today's guest, Margot Morton, is no stranger to revolutionising how we deliver healthcare. During the pandemic, she co-designed virtual models of care that were implemented nationwide. And now she's got a vision for making healthcare more accessible, efficient, and community-centred. Welcome, Margot. Can you talk to us a little bit about some of the most impactful virtual health experiences you've witnessed or been involved with in the last decade?
Gosh, there's so many. I think the ones that really stand out are the massive problems that happen quickly that need a response quickly. You know, during the pandemic, there was a cruise ship off the coast of Victoria that had 750 patients that were COVID positive, and they couldn't come into port. And so they needed virtual consults and antiviral scripts, and Uber's organised to pick them up. And I got that phone call at 3:51 a.m. in the morning. Can you do 750 consults by 8 p.m? You know.
Of course I can.
Yes.
Yeah.
Yes. And you know what? You just go, yes, I can. And then you work it out quickly. So I love that. I love that type of challenge. And we did. All those patients received a consult. Those who needed antivirals received their script, and those who needed an Uber home, their Uber was ordered, and all patients left the ship and were isolated for COVID. So we sort of met that mark. So those type of challenges were fantastic, delivering virtual care. Then you've got the ones that are really quite meaningful in areas in remote and regional Australia that do not have access to healthcare 24/7, and to be able to put a virtual care solution in remote and regional New South Wales was one where you see a family that drove for 3 hours to be able to get to the virtual centre to be able to have a consult with a doctor, and you hear the mum go, you know, we're going to see the doctor on the television, and the kids saying, I want to see the doctor on the telly, you know. So that sort of thing really, really hits you and realises what you do is quite meaningful in delivering those models of care.
Do you think virtual health is solving the same problems, or do you think it's really tackling sort of a new sweep of problems that we just didn't have a solution for before?
I think it's always been there, like all of us collaborating. We've spoken about the possibilities of virtual care for almost a decade. We've implemented some of those and rolled out some of those models of care. However, the pandemic really pushed us into that location where we're actually able to make things happen.
Yeah, sometimes it's shock in health, isn't it? It's shock in health that allows us to do the dramatic change.
Yeah. And, you know, I pose the question too, to get things done, do we need to pretend we're in a pandemic? Right? Because we very quickly go back to too many checks and balances sometimes, which is important, but there's got to be a happy balance.
Are you inspired by any particular innovations that you've seen overseas that you're excited about the idea of seeing come to Australia? I know you're out there at all of these futuristic conferences and the like.
Yeah. You know, the NHS, even though it's a constitution, like the monarchy over there, the NHS, but they have some inspiring models of care where they're using technology. For example, they're using triage kiosks, you know, they're using scanning technology for OBS and vitals, and they're doing a lot of studies on making sure that AI and scanning technologies is covering all nationalities. You talk to clinicians and they go, there's a lot of AI, there's a lot of technology that doesn't take into account different nationalities and different skin tones.
Oh, okay,
a lot
right.
of technology that's
so
actually
we're not talking
designed.
language, we're actually talking...
No, we're actually talking skin tone.
Okay.
So yes, there's some new technology that's coming out of the NHS, which I'm very excited about whether we can bring to Australia.
Now, I know that in the last few months you've been developing a sort of a new solution for us here in Australia.
Yeah.
Tell us a bit about what you're working on now.
Yeah, so as I mentioned, what we saw during the pandemic was people were pushed into receiving virtual care and telehealth, and they accepted it. But what we're seeing now is that there's only 23% of the population that have embraced virtual care or telehealth as their first access to healthcare.
So there's been a drop-off post-COVID?
Yeah.
Okay.
Yeah, so we've seen a drop-off post-COVID. And what that tells us is the data tells us that people still would like to go out to access their healthcare, right? I'm sick. I'm going to go out to access my healthcare.
I mean, it's counterintuitive a little bit, isn't it? You think, oh, I'm sick, great. I'll put on my computer and I'll talk to somebody from bed. But you're saying that's not what we're seeing. Okay.
That's not what the data's telling us. And when we talk to the patients and look at the patient experience data, it's because they present to a hospital or an urgent care centre or their GP because that's where they feel safe. To you and I, we know that it's probably a broad spectrum antibiotics will solve the problem, and we can do that by a virtual consult, or it could be indigestion. But to somebody else, it could be a heart attack, right? So to the normal consumer, the normal patient walking into an ED or walking into a hospital is where they feel safe. So they're still going out to access healthcare.
So are we doing enough to educate the community about the data that we have now around the quality of care delivered virtually? Is there a big job to do on the promotion of virtual care?
Yeah. And again, like the data tells the story. So when we talk to the consumers, when we talk to patients, they actually, the majority of them, over 80% of the people who have participated in a virtual consult in the past 24 months from 2023 to 2024, that virtual consult has been with their GP. So a telehealth follow-up consult with their GP. So no, we're not doing enough. They don't know that they can call Health Direct, for example, and receive that consult that they need. So we definitely do need to do more communication in that area.
Yeah, because, throughout this series, we've been talking to a lot of different people involved in different aspects of virtual care, and there's so many exciting models of care now available. But I do think even my own knowledge of what I can access in New South Wales today, it's probably a bit patchy.
Yeah.
So that's probably somebody else's job, not yours or mine necessarily. Yeah. But there is a really good communication piece, I think, around the acceptability, the quality, and the experience. I think you and I have spoken before about people's experience when they're actually using these models of care is positive. And the workforce as well. Clinicians are happy as well. So, when we think about the constant burden on the pointy end of our healthcare, we seem to have the technology now. We just have to be encouraging the diversion of people to where they need to get the care, right place, as we say.
That's what we've been working on. And so what we see is we now need to do a transition and a blend of digital assets and physical assets.
Okay.
And so we still need to give people the assurance that they can go and access healthcare and where they'll be safe, but we need to give them the experience that the virtual care actually delivers the results that they're after. So what we've been working on is we have, and I've done a lot of research on this during the pandemic to try and find soundproof, clean health pods. So pods. What a health pod is like a telehealth pod. So it's like a phone box.
Okay.
But a phone box designed for hospital grade standards and with a touch screen that patients can connect virtually.
Okay.
That it's safe, that it has nurse duress medical escalation available for them, that it can be soundproof so they can have a consultation, because we know that a lot of people, their aversion to virtual care is because they can't have a confidential consultation at home because of other family members. And it's also private, so it's screened so people can't see in there. So if they need to show a wound or a lesion, that to the doctor on the screen that they can. So it's really important to have a safe, clean, hospital-grade environment.
Okay, so at the moment, one of the roles for these pods is sort of as an ED diversion pathway.
Yep.
So talk to us a little bit about how this would work in a hospital environment.
Yeah, so putting the pod in a hospital environment or in an ED is basically what we call low acuity manager. So it's an established model of care that we've been using with low acuity manager. And what it means is the patient comes into the emergency department, checks in, and then is triaged, and they meet a certain criteria that gives them the choice of a virtual consult.
Okay.
So the triage nurse will say, Mrs. Jones, thank you for coming in today. You have a choice of a virtual consult. The doctor's available now, or the next available doctor will be in 2.5 hours. So your choice. So the patient always has a choice of what they'd like. What we see is the majority of them will say, no, I want to see a physical doctor. They'll sit down, and whilst they sit down, they receive information about the virtual consult. And then what we're seeing, that over 90% of patients will come back and say, can I have the virtual consult, please?
In the same consultation?
Yeah.
Okay.
Yeah.
So the waiting leads to adoption.
Yeah, adoption,
Okay.
exactly. And then we're also seeing that we have over 90% rate of discharge from virtual consult if you make sure that triage criteria is very clear. So therefore, patients that are coming in for a medical certificate, patients that are coming in for a repeat prescription, patients that are presenting to ED that potentially it's just a broad spectrum antibiotic, right? Those patients very clearly can have a virtual consult, referred back to their GP for follow-up, receive what they need to their phone, and discharged.
And this is part and parcel of the emergency department in which it sits. It's sitting in the waiting area, not the department itself.
Yeah, in the waiting area.
In the waiting area.
In the waiting area.
And the way it's being trialled at the moment, you're involving departmental staff.
Oh,
so this isn't
absolutely.
an external model that
No.
sits in a hospital department. It's people in the department, people at home.
Yeah.
Is this a way of really thinking about a new flexible way that people can work?
My vision is that we can say, Dr. Smith is rostered to pod 21 at the domestic airport, right? That's his work from home day,
Right.
But yes, so this particular one is an ED version. The pod would be situated and is situated in the trial environment in the ED. And is part of the workflow for the entire team. So the triage nurses, they actually know who the doctor is that's rostered to that pod. It's all integrated into their system. It's not an external workforce, and it's just becomes part of how we manage.
Are you working with a particular emergency department team to get through the nuts and bolts of all of this? Is this in trial somewhere at the moment in Australia?
Yes, so we have one set up in Victoria at the Austin, and Associate Professor Michael Ben-Meir, he's a bit of a pioneer.
Bit of a guru,
Yes, a bit of a pioneer. So we're working with him within the Austin, but after being at the forefront of virtual care for several years, there are so many key stakeholders that we're doing discovery sessions with. So working very closely with Ministry of Health here in New South Wales, and the key stakeholders there are all very keen. So we're planning in the first week of next month to have a design session with the team here at Ministry. So
Okay, that's
very
exciting.
It is.
And what are your early results or feedback from those sort of collaborations with the clinical groups?
Well, lots of lessons learned,
Yep.
which is great. Dr. Michael Ben-Meir, he did just put the pod in and then say, there we go, that's what we're using.
Right.
We know that without education and engagement, new innovations don't work, right? There's a lot of resistance, and quite rightly so. We're very conservative in health. We want to make sure that the patient safety is at the forefront of our decisions, and it's not just about speed and moving the patient through quickly and patient flow, although those things are important. Patient safety is the number one, and patient experience. So yes, the lessons learned were that we need to actually bring everybody on the journey.
Yeah.
As we know, change is difficult. So yes, developing those models of care with the clinicians is absolutely vital.
We think a lot about the lack of flexibility for health workforce sometimes. We don't get as much of a chance as doing a hybrid work from home model and the like, with people getting sick all the time. It feels like to me there's also an opportunity for people who really want to function in a part-time capacity, or maybe are on long maternity leave, or are at a particular phase of their career. In a way, this offers a little bit of a little bit of different flexibility when you're looking at the makeup of an ED department or team. Are you seeing that people are sort of seeing opportunities there?
There's a few barriers, and I didn't really see it until, again, I reference the pandemic, but when New South Wales physicians and clinicians were inundated with COVID patients in the emergency departments, I was working with a virtual care team where we had over 150 FACEMs, fellows of the Emergency Medicine College, and when we put out the call to say New South Wales is swamped, we really need to help them, we saw clinicians from all over Australia where they weren't inundated pick up their phones, open their laptops and start taking virtual consultations to help their colleagues out.
Makes you shiver, doesn't it?
Yeah.
Yeah.
I was absolutely amazed. At one point we had over 70 emergency specialists taking virtual calls just for New South Wales health patients. It was quite remarkable. So that whole collegiate approach, I think, also lends itself to the future workforce. We want to retain our clinicians. We want to support our clinicians and we want to keep them in medicine. So to offer more flexible workforce environment for them where when they're on maternity leave and they can see that the ED that they work at is absolutely inundated, they may want to take the choice of opening their laptop for 2 or 3 hours to take virtual consultations for that ED. They may want the flexibility of being able to, have one day in every 10 days that's working virtually. It also provides great training I've watched clinicians deliver virtual consultations. They're very clever, to the fact of, have you got an iPhone on you? Yes. Can you turn the torch on? So if you could just lean back and put the torch, so I can see the back of your throat virtually. They're very clever. We're very blessed in Australia to have clever clinicians.
I think it's an interesting idea to make sure that this sort of ED diversion involves in-house team. I mean, I think a lot of the virtual services that are being developed now, involve clinicians that are perhaps very remote or unattached to the community, unattached to the environment. And we do know, in health context of community is so important. And we have struggled in regional, rural, remote, and we've used virtual services when there are opportunities to bring clinicians through and situate them, at least for a time, to really understand the context. The care changes. So I think it's an interesting model that you're proposing. It's not a sort of an add-on to the department with people sitting somewhere else necessarily. And I think that's an exciting option for clinicians attached to a hospital to think about how they might modify their own workload and the like. I imagine you have many other use cases for your pods outside of ED diversion. Yeah. Let's talk about some of those.
I'm a huge fan of preventative care. I think if we can teach people, how to care for themselves, how to make sure that there's 5 colours on their plates, how to eat healthy. And I believe that the pods can also have a use for our healthy living programs. New South Wales Health has got an amazing healthy living program. And if a patient can enter the pod and pick up some healthy living, enroll in the healthy living program, find where their nearest walking group is, receive some seasonal healthy recipes to be able to take away with them, and then also find out some further information. I believe that that's really important, and I believe the pods could be used for that. Even the healthy living program enrolment could happen while they're waiting for a consult.
So that brief intervention.
Yeah, so that brief intervention of educating with preventative care. The people who are turning up to ED for the low acuity, the 4s and 5s, they're not the people who are involved in health that actually know when we should and when we shouldn't go, right? They're the people who actually would like and can take the preventative care and enroll in the healthy living program. I also see the pods, because we have them LED screens, so they're quite dynamic, so you can change the pod up to suit what's important to that community. I believe that we can have the pods themed, so it can, if it's Heart Week, they can be about heart information and cardiovascular health, again with that preventative streak going through it.
some of our regional and rural communities, which are, running with hardworking MPS staff, you can see the opportunity for a pod like this to support, GP, emergency, public health, as you say, mental health. I mean, I think there's probably a big scope as a place, a safe place, a safe private place to go in a community to access mental health services which aren't readily available. Are these all areas that you're developing?
In actual fact, part of the discovery process for this project, the amount of clinicians and consumers that we've spoken to and communities, the feedback has been loud and clear for a safe, clean space within a library, within a council chambers, for those remote and regional towns that do not have a clinic or an MPS, a safe place for women who could be potentially suffering from domestic violence that can go and have a consult in a private, confidential space in a soundproof environment so they can have that consult. The need is absolutely there. And it doesn't have to always be remote and regional. The pods, because they're dynamic, they can be something very simple like an Are You OK pod, so people can hop in there and they can, on the touch screen, there's a choice, choice to book a consult with a clinical psychologist, choice to take some time out with the Japanese garden and some relaxing waterfall music, or in actual fact, just to be able to do Tetris for 20 minutes. Okay. Right? So there's all these options, and we know that providing that environment doesn't always have to be a clinical consult. It can also just be psychological safety. So this is happening at home. Where should I go? What should I do? And Health Direct provide all of that service. So if the touch screen within the pod actually puts them through to Health Direct can then navigate which areas and support that they actually need.
I think the mobility of the pods is an interesting opportunity. It feels like it allows an organisation like New South Wales Health to be responsive. I think about the need for workforce to sort of be deployed to certain areas, let's say after a flood, after fires, after natural disasters, or other crises like the terrible events at Bondi Westfield, where you could see a use case where these, rather than the movement of people necessarily, we've created an environment to allow people to connect safely, but without that idea of having to uplift and fly in teams of support. We need the support there, no question, but this might be another way of delivering that support.
Oh, absolutely. From a disaster recovery that you can drop in the pods, and so therefore people still have access. Particularly in Australia, I think 70% of the year we have a trauma somewhere, right? Whether it be a flood or a bushfire or a drought or we're a harsh country, and our communities get separated from where they need to be. They lose access.
Let's jump to 5 or 10 years where these pods are ubiquitous or a built-in part of health.
Oh, I love that too.
What are some of the sort of visionary add-ons that you can imagine becoming part of the pod? You talked about clients, patients being able to sit in and their obs sort of being automated and the like. Do you see other new technologies being able to be added in, making this a real sort of futuristic Jetson experience, or some sort of scanning as you walk into these pods eventually, and it giving the clinicians a whole barrage of data points to work with beyond the conversation that they're having?
Yeah, look, my vision now, which I want to see, and talking to different parties about how we're going to make it work, is that, for example, if we're in New South Wales with a pod, you'd scan your New South Wales service app, and that would enter your details and unlock the door, pre-populate the information, and as I sat down, an animated person would pop up on the screen and say, "Welcome, Margot. We noticed that your last consult was with your doctor, Dr. Wilkinson, a month and a half ago, and you received broad-spectrum antibiotics for a chest infection. How are you feeling now?" Like, that is the ultimate in interoperability and a personal experience, isn't it, right? And then you go into your consult and discuss, and And did you know that autumn seasonal vegetables are available at Harris Farm behind you, which is a 5-metre walk, and please pick up some sweet potato and make yourself a lovely soup, right? So it's about interoperability with the health pod, that would actually be able to pick up everything that I have done in my health and can talk to me about my health. And that the scanning technology is available there, so it can read my SAT levels, it can read my stress index. This is already there. We just need to pop it in. My respiratory rate, my blood pressure, my pulse, and all of that scanning technology happens as I sit down. I'm not a believer in this business of BMI, so I'll never put that in the pod while I ever have anything.
Okay.
But definitely I see that these become a completely interoperable experience for the patient.
Do you know of these pods being operational in other countries? Is there something similar going on that we can look to for the trajectory of this?
Yeah, look, the Japan, Korea, a little bit in the UK, have implemented health pods in the street, but it's mostly private organisation for repeat prescriptions. Okay. That's how it's being used. It's not actually being used as a health pod. We look to those technologies. It's early days, but we also need to look at the populations. So there are different populations are more adoptive to new technologies than potentially Australia is.
I wonder if that face-to-face piece is really going to change as we move through. So I wonder if the kids that Snapchat each other endlessly now rather than meeting up at the mall or the park, I wonder whether that group, as they move through, are going to be less interested in sort of bricks and mortar and much more interested in the virtual world of health. Is that what your evidence is telling you now? I mean, is this a sort of a generational pathway that we're on?
My own children are 27, 30 and 33, and in actual fact, I keep saying, you need to go and see your GP. Right? Mum is safety netting because they do everything virtually. So this is where I think it's really important with our messaging as, elders in healthcare, which I am, that it's really important that there is a balance. You do need everything, and that would be part of the preventative care messaging that you would have in the health pod would be, and now follow up with your GP, and now follow up with your GP. Totally important to make sure that the patients actually receive that face-to-face care and we don't move away from that. It's got to be a balance, and it's got to be about receiving the right care at the right time and having access to the care. We're seeing definitely a lot of GPs have approached us about wanting to run a pilot for follow-up consultations for their aged care facilities.
I was going to say, we haven't tackled aged care, but that feels like a real opportunity. I think no one wants to see our older population waiting in emergency departments if we can avoid it. And yet, as you say, that they have ongoing medical needs to get a staff member or a family member to come in, attend an appointment and back, disruptive for everybody. So that's really
expensive.
Interesting. Yeah. So tell me what the interest is there.
Yeah, so we've have a number of GPs that have approached us. Of course, they love the ethos that everybody should go to their GP, so they're 100% behind us in that aspect. But if they could put a health pod in the community centre of the aged care village, so therefore, if the patient's ambulant, then they can actually go to the health pod to follow up rather than having to be taken down to their GP. So they have their normal checkup with their GP and their follow-up consult, which is usually 5 to 10 days after, to see how they're going with the new medication or what changes, whatever the discussion was, that they can have that in their aged care facility, which means that it frees up the GPs that they can continue to see initial appointments and consults, but they can also make sure that they check in and we don't lose this continuity of care between the relationship between the clinician and the patient, because we still don't have very clear continuity of care as much as we try. if that patient needs to go to the hospital and the aged care facility calls an ambulance and we take that elderly patient to the hospital, the GP doesn't know about it until that patient comes back and then needs a follow-up GP appointment, and the GP goes, well, I didn't know that you were in hospital. So we haven't quite got that right yet.
So your vision, no restrictions, are pods, everywhere? Or is this an addition to what we're doing? We're not really replacing anything with pods. We're just giving people choice and options?
Yeah, it's really just a transition, a blend of physical and digital assets, to create that physical single front door for patients. It's very important that we take a conservative approach. It's very important that we consider patient safety. I would like to see that the initial period for the first 2 to 5 years of our health pods are in an environment where there's medical escalation available. So if it is in an ED and the patient is triaged to the pod incorrectly and there is an incident, then there's medical escalation available. The same with a medical centre or an aged care facility where there is a nurse available. I think that's really important. As much as I would love to go crazy and just pop pods all over the place, patient safety is the number one.
It seems to me like what you're expressing here is that stepping stone that we really need at the moment to protect our hospital services from the sort of relentless demand, but also really provide that safe space for our community to be able to access the healthcare that they need. It's an exciting intervention. Am I describing it in the way that you would?
Look, I think we have virtual care. Everybody knows about it. Everybody knows about telehealth. We also have, knock on the door of the ED and turn up to the ED. Where I see the health pod is actually a blend of digital and physical assets. So we bring it together and it's a transitioning from physical to virtual. So that's where I see the gap, where we haven't been able to get virtual care to be embraced completely.
Margot, exciting, interesting. It's a watch this space, and I look forward to seeing a pod in a community centre near me sometime shortly.
Absolutely. I think we'll pop one in the foyer.
Thanks, Margot.
Thanks.